For most of us, this is what we think of when someone says healthcare. But technology and state-of-the-art buildings do not tell the whole story. The essence of healthcare today goes well beyond the science of medicine. It goes to the heart of what it means to be a physician.
When you're a physician, you don't just treat disease, you treat people. And people are more than the sums of their health problems. There is an ethical and a human dimension.
How we train physicians is essential to ensuring a balance between science and humanity. In Kansas City, we are fortunate to have not one, but 3 medical schools. Each has its own distinct training model, and each has benefited from a relationship with Doctors Marjorie and Bill Sirridge. The Sirridges are graduates of the University of Kansas School of Medicine. They were among the founders of the University of Missouri Kansas City School of Medicine and frequently lecture at the Kansas City University of Medicine and Biosciences. The Sirridges believe deeply that there is more to a doctor's training than scientific textbooks. That is why the Sirridges created a Department of Medical Humanities at the UMKC School of Medicine soon after its opening in 1971.
We felt it was very important that the students learn more than just the science of medicine, which in itself is very important, but that they also learn something about the way in which people feel, how they feel when they're ill, what makes a difference to them in life. And so early in the career of the school, we brought together people from the College of Arts and Sciences and people from the medical school to talk about ways in which we could bring these aspects of life into the medical educational world.
Thanks to the Sirridges, thousands of Kansas City-trained physicians are well grounded in medical humanities and ethics. In fact, many attribute their ability to live and practice what they've learned to their relationship with these 2 physicians.
We use this term very respectfully. We talked about Marjorie as Mother Marge because she had the right blend of the role of teacher as well as the role of parent, and certainly helped form my ideas of what I wanted to do as a specialist.
Out of the 40 years that I've known Dr. Sirridge, my impression or my respect for her has not wavered, and that is because of the integrity and the respect and the honesty that I've seen in them throughout the years that had never wavered.
Chancellor Robert Hemingway is proud to claim the Sirridges as graduates of the University of Kansas Medical School. He says the Sirridges have made enormous contributions to advancing medical professionalism and medical ethics, and that their steadfast commitment has enabled these values to be embraced by the physicians of tomorrow. The Sirridges' commitment to humanities and ethics didn't end at the medical school. In 1984, the founders of the Center for Practical Bioethics, UMKC philosophy professor Hans Uffelman, Dr. Karen Ritchie, and attorney Mary Beth Blake invited the Sirridges to become charter members of the center. Then and now, the Sirridges wholeheartedly embrace the center's vision of a society in which the dignity and health of all people are advanced through ethical discourse and action. The Sirridges have continued as active members and faithful supporters of the center for more than 2 decades.
We can't solve problems inside our doors here. We need community support, and we see it in institutions like the Bioethics Center that allow us to reach out into the community. We often don't do it ourselves very well.
While Dr. Marjorie Sirridge remains active at UMKC teaching humanities and ethics, the influence and resources of the center are close at hand, serving as a convener for all 3 medical schools on major health issues.
The 3 medical schools, for example, worked together 7 or 8 years ago to work on an end-of-life care curriculum that would be the same across the medical schools. And it was a very, very vibrant and meaningful effort that was put together and moved forward by the Center for Practical Bioethics. And that's what the center has always been about, practical bioethics.
The Sirridges believe that a physician's ability to understand the ethical, social, and moral factors of a case has implications not only on patient care and outcomes, but also on the well-being of the overall community.
what we do here affects so many people and affects communities, affects health in the whole world, actually. And it's so easy for us to think it all happens right here, but it doesn't.
For the Drs. Sirridge and other physicians, the Center for Practical Bioethics provides a safe place to raise and respond to the ethical issues in health and healthcare.
I think in this era of sort of protocolized medicine, one of the things that the humanities and bioethics bring out is that it's very important to look at each patient individually.
They have utilized the center to be a catalyst for the teaching of ethics, not only in medicine, but across the community, in research, in the disparities in healthcare.
Sirridges are an important part of the Kansas City community overall. They're not just physicians, they're community members who value the city itself. And so it's not surprising at all that they would be involved with the Center for Practical Bioethics.
Chancellor Hemingway believes KU and the medical school are stronger because of the Sirridges and their work with the Center for Practical Bioethics. Medical professionalism, altruism, competence, integrity, caring, and compassion are at the heart of what it means to be a physician. The Drs. Sirridge live it. In concert with the Center for Practical Bioethics, the Sirridges and doctors across the country work with patients and families to make decisions that ultimately provide the greatest peace of mind possible for those who must decide.
The opportunity to be a practicing physician, the opportunity to be a teacher, the opportunity to be part of a medical humanities process, these have enriched our lives tremendously.
Congratulations to the 2007 recipients of the Vision to Action Award, Drs. Marjorie and William Sirridge.